As a physician, and especially a functional medicine physician, we're always looking for more tools in the toolbox. And I am not aware of anything else that has the ability to bring these levels down. I mean, I've worked with nutrients and supplements in the past and different protocols that work, but not to the extent that we are seeing with this. My name is Dr. Julianne Arena, and I did the MDLifespan Toxin Protocol. I am a conventionally trained OBGYN physician and had worked in a private practice for over 15 years when I then discovered integrative and functional medicine and went back and did a fellowship with A4M and found my calling and currently opened a practice. I have a practice called Waves of Awakening, Center for Personalized Medicine, where I work with patients to get to the root cause of what's going on with them and also work on balancing hormones and longevity. Because I always say that I practice what I preach and I'm looking for root cause in what's going on with my life and my goals to live a healthy, long life, I'm always looking to learn more and test and not guess with myself as well as for my patients. So I was noticing a little bit of fatigue, and also I had this chronic nasal drip that I knew I don't have allergies, and my sense was something deeper is going on. So I wanted to get to root cause and do some testing with my doctor. So I was having this sort of spontaneous onset of nasal discharge, and I thought, that's not me. What's going on? What's going on in my environment? What am I doing? What are my foods? And then also, what sort of toxic burden does my body have? And so I'm a tester and not a guesser. So I did a lot of testing with my doctor, and we found out that I had pretty significant mold exposure. And I always thought, I'm not a mold person. I'm not like my patients. I don't have mold. And I did. And I had some other toxic burdens as well. I learned about MDL's plasma exchange program probably a little over a year ago, as I was talking with Dr. Smith about her research and the amazing data that they were starting to gather and the results that they were starting to see. So we had a conversation about, okay, is this something that makes sense for me to do? And knowing I'm always trying to get to root cause and live optimally and be as healthy as possible, I was definitely intrigued with the data that she was showing me and wanted to go down that path as well. The data that was most impressive for me that I saw was mold toxins and microplastics, because I pride myself in living a healthy life, but there's some things that we can't avoid. There's exposure. And I didn't, think I lived in the typical moldy home or have typical symptoms. But what we don't realize is those symptoms could be buried, cognitive, not typical. So I wanted to see where those were coming from. And I had an inkling or an intuition that this nasal drainage was due to mold toxin. In the process of going through this program, I did a lot of testing. I did comprehensive blood work, I did urine testing, I did saliva hormone testing, and was able to get the data. I was most impressed with the information about mold and microplastics. I had previously been balancing my hormones, so there was nothing unique there. But I was impressed with that data, thinking that I'm living such a healthy lifestyle, but there's still so much more that we can do. When I first got my results, I was excited, but also a little anxious and frustrated, thinking, again, I live a pretty healthy lifestyle. Where is this coming from? But then the results are also a motivator for, I want to get this out. Right. I have a family history. My parents struggled with dementia, and I have a family history of Alzheimer's. And I know, the whole body connection in a functional medicine approach. And so my brain health is extremely important. I was motivated to try to get these out of my system. After I got my test back, we did a comprehensive review, talked with Dr. Pamela Smith to figure out what was the best plan or approach for me. And given my results, the toxin protocol seemed like the best fit for me. Before the procedure, just like anyone, I wanted to do a lot of research. The website was extremely informative. I watched a lot of videos, and there was pretty much a step-by-step process of what to expect. the connection and communication with the staff of the MDLifespan is wonderful. And I connected with my nurse, Angela, who prepped me prior with expectations. She was available for questions. And really, each time I went through, it was a streamlined process. I felt very safe and comfortable and well educated on every step of the way going through the procedure, right? It could be scary. Even though I'm a physician, I'm still a patient. And so there are expectations there. But Angela was extremely professional in explaining, and I had a lot of questions because I am a physician. Well, what is that? And what are you doing? And, open the machine so I can see. And she was very open to educating me about all of it. I've completed my 3 sessions of the toxin protocol, and I feel great. That nasal drip is gone. And I have to say, my energy is great. And even being a healthy person, I have stepped up my game, and they give you support, and they give you a vitamin drink that I take faithfully. And I think that makes a difference. I feel really good. And my follow-up testing was fabulous. My toxic burden is low. My mold is essentially gone. My cognitive testing has significantly improved. And that's such a big difference for me, knowing that I'm trying to stave off family history of Alzheimer's and dementia. I feel really great after the whole process. My family history is a very big motivator for me wanting to be healthy. My grandfather, my father's father, had Alzheimer's, and my mother had Parkinson's disease. And as a functional medicine provider, yeah, I know there's a genetic component, but I also know that there's an environmental component to it as well. And I know all of these things played a role. So that was a huge motivator for me, and what I try to impress upon my other family members, as well as my patients, about really working hard to bring that body burden down. And so this was an amazing opportunity for me to be able to do that. Before I started beyond the nasal drip, I think there was probably a little bit of baseline fatigue that I had compared to now. When I was in the decision-making process of doing this protocol, I knew it was going to be a commitment, a financial commitment, a health commitment to myself, a scheduling commitment, and then also to really hone in and follow the protocol. I routinely live a healthy lifestyle, but now when you're deciding to do this, you sort of want to up your game and really follow that path. So I took a lot of time to think about it, but I was very motivated by my test results. And again, my goal is I want to be in my 80s on the floor with my grandchildren and be able to get down and get up on my own. I work with women pre-pregnancy. During pregnancy, I transfer them over to a traditional OBGYN, but postpartum, I work with women as well. Where my passion is, now knowing what I know, is getting women in prior to pregnancy. So before my experience with TPE, I was also working on trying to bring someone's body burden or their toxin level down so they are the healthiest they are prior to pregnancy, because we know we pass that through with pregnancy. And now knowing that TPE is an option, why wouldn't we want to get our body burden down before a pregnancy so that it can be optimal, and then we're transferring a much better healthy life to our babies? This has brought me to a new level of health, but we know life happens, right? And even if we eat the cleanest and sleep and move our bodies, there are environmental exposures that we cannot control. But knowing that this procedure is out there, it's a really good thing, because you know that you can sort of get a reboot. Now, that's certainly not an excuse not to do your work and not to live that healthy lifestyle, because it's not an easy fix. You will not get the results that you want to get if you are not doing all of the other things. You will get some results, but you won't get as good. So in continuing to live a healthy lifestyle, but knowing that this is an option down the road for a tune-up or a reboot is a great option. I'm always thinking about toxic burden with my patients. I have started to talk about TPE. Patients are getting more and more savvy and educated. The week after my first TPE, a patient came in to me and asked me about it. And I thought, funny you should mention that. I've just gone through my first one, and she was intrigued, and we were having a dialogue about it. We definitely need to get it out there more. Yes, we need more data in research. We need the ability to make it cost effective so we can reach more people and change more lives. Thinking about your health, we sometimes have to think outside the box, and doing that sometimes includes investing in your health. I often will talk to patients or people when we're talking about the finances of your health. Investing in your health is probably the most cost effective thing you can do to avoid the burdens, the illness, the disease, the cancers that are potentially happening down the line, and then the cost of all of that.